With all our hearts, we pray and ask, God bless Anambra, God bless the shining light that we bear. We're the only ones to make her brighter, the only ones to make her better, the only ones to make Anambra shine. With our sweat and blood.
From the light of the nation, Anambra State, this is Solution Footprints, bringing you the significant developments and remarkable activities of the Professor Soludo-led government in Anambra State. I am Ife Aronwo-Kafo, right here inside the Chukwuemeka Odumegwu University Teaching Hospital, Amakuoka. Well, underpinning the solution transformation agenda in Anambra State is the quest to achieve a livable and prosperous homeland where people can live, work, learn, relax, and enjoy. Access to quality healthcare is a key indicator of livability and human capital development, which is captured in the Solution 5 pillars, human capital and social agenda. In the Soludo Solution People's Manifesto, Professor Soludo set a clear mandate to deliver access to quality and affordable healthcare for Anambra, towards ensuring a minimum global standard in healthcare delivery. On this edition of Solution Footprints, we'll spotlight the far-reaching interventions of Governor Soludo in the Anambra State health sector for the good health and well-being of Anambra, where we were in the Anambra State health sector and where we are now. Our reporter has more.
On assumption of office 21 months ago, Governor Soludo CFR set out a clear mandate on how to revamp the Anambra health sector, which was in complete shambles. Majority of the hospitals and other health institutions were more of consulting clinics without doctors and other medical personnel to attend to patients. One of the major initiatives the administration undertook was to conduct a gap analysis to ascertain the level of intervention required to meet minimum global standards across all health facilities in the state. The result of the gap analysis showed that the healthcare delivery system in Anambra State was in a deplorable condition and it needed urgent intervention. The gap analysis shows that 19 general hospitals were without doctors and only some with few nurses. There were equally no drugs in the hospitals. Governor Soludo immediately swung into action, ordering the immediate recruitment of doctors, nurses, and other medical professionals for all the 19 general hospitals and primary health centers in the state to fill this gap. This initial recruitment comprises of 46 doctors, 10 consultants, 138 nurses, 25 pharmacists, 10 laboratory scientists and technicians, 10 radiographers, and other medical professionals. Currently, the ongoing recruitment aims to employ additional 500 more healthcare workers, totaling 1,000 professionals under Governor Soludo's administration, a historic milestone for healthcare delivery in Anambra State.
And that's why we are paying a lot of attention to universal health. There were many hospitals without doctors and medical staff when we assumed office, 19 of them. But we recruited over 300 professionals, doctors, pharmacists, consultants, nurses, and so on. And the other day I approved again 500 healthcare workers, given our primary healthcare centers. We want to make medical services already available for everybody, especially to the poorest of the poor.
This is unprecedented in the history of healthcare delivery in the state. The Health Ministry also formed a drug revolving fund in conjunction with Global Fund and UNICEF to provide drugs for the health facilities across the state. In Instructively, 6 building blocks characterize the health ministry under Governor Soludo aimed at improving the system. They include leadership and governance, human resources, access to essential medicines, infrastructure and equipment, ensuring highest possible level of health and well-being and their equitable distribution by focusing on people's needs and possibly improve prevention as well as service delivery. In addition, the administration of Governor Soludo embarked on a series of staff training programs to ensure efficient service delivery. Some of these trainings include training of pharmacists, emergency medical services training, oxygen delivery devices training, life support skills training, clinical procedures to end neonatal deaths in partnership with UNICEF, helping baby breathe, modified life-saving skills, among others. This has helped in training staff with a resultant reduction in under 5 mortality and maternal mortality in public health facilities in the state.
These are hands-on clinical skills they are doing. By next tomorrow, they are going into the field, to the hospitals, to practice these hands-on clinical skills. They finish with the theory part of this training. So this will go a long way in reducing maternal death in Anambra State, since they will be able to recognize the danger signs and know when to refer and when to treat.
We are training a total of 50 health workers. But within the purview of this training, towards the end, we are going to pick a specific number of them that we train as trainers, so that they'll go back to their areas, local government areas, and step down the training to other health workers that don't have the opportunity to attend this particular training.
At inception, the administration of Governor Soludo met a health sector where 80% of the people depended on private medical facilities for health care, while a paltry 20% access health care in public health establishments, a ratio that further demonstrates the existing gap in the sector, especially in the public health segment. It is also pertinent to note that the Soludo government met 5 local government areas without general hospitals. This became worrisome, especially in areas that were hard to reach. Governor Soludo immediately began addressing the infrastructural decay in general hospitals like Umueri, Enugu and Ekwulobia, initiating renovations and acquiring state-of-the-art equipment. There is also an ongoing construction of 5 general hospitals at Oboko. Other far-flung areas such as Enugu to Aguleri in Anambra East Local Government Area and Orome Titi in Anambra West Local Government Area, all in Anambra North Senatorial District. Governor Soludo also revamped the primary healthcare system, which had collapsed, including the completion of 9 primary healthcare centers supported by UNICEF. Approval has also been secured for the total renovation of 326 primary healthcare centers across all the wards in Anambra State with solar power, as opposed to what was encountered on the ground, where pregnant women delivered on a wooden table. Currently, the state government is equipping 17 general hospitals laboratory to render services to the people. Governor Soludo's administration commenced cancer awareness, offering cervical cancer screening and treatment, which has screened about 13,839 people and 242 persons were positive and 40 people has been treated successfully.
It's one of the mildest vaccine because even people that took it, the inflammatory effect that follows most immunizations is very, very much less, in human papillomavirus. What is important is our people's awareness and then the availability and cost.
The administration is about to expand the breast cancer screening and treatment in the state. Equally, there is ongoing building of cancer register which never existed in Anambra State before the coming of Governor Soludo. There is also the establishment of telemedicine hub at Okuzo, which allowed residents to consult doctors remotely. Is another intervention of Governor Soludo launched on 14th September 2022. A total of 5,638 calls have been received so far, accounting for 85% successful treatment, while 15% were referred out. The initiative is currently expanding to all local government areas where doctors will be assigned to all the primary health centers in each local government using the hub and spoke model. This has helped to prevent diseases as well as made the people have unfettered access to doctors online. This initiative has drawn the attention of all the states of the Federation, who have sent their medical representatives to Anambra State to understudy and replicate the idea in their respective states.
You're welcome back to Solution Footprint, and we have seen how the solution revolution in the Anambra State health sector began. Now, there have been lots of commendations for Professor Charles Soludo for his intervention in the Anambra State health sector, even from unexpected quarters. What are the benefits that the Anambra are deriving and getting so far from all these interventions? Watch this.
Before the advent of the administration of Governor Charles Soludo, CFR, general hospitals across the state were almost comatose. This means there was infrastructural decadence in the health sector. The general hospitals in Umueri, Enugu, and Onitsha were in complete shambles in terms of infrastructure. Today, with the commitment of Governor Soludo to healthcare delivery, these hospitals are currently being renovated and remodeled, including the procurement of state-of-the-art equipment to boost healthcare delivery in these hospitals, which are strategically located in the 3 senatorial districts of the state.
As you see, this is one of the upgrade of one of the 3 general hospitals we started here. You can see we have got the place on schedule. You can see the contractors working to ensure that we meet the deadline, though we have missed some time on this completion, but you can see that they are doubling their effort to ensure that the work is completed. The similar work is ongoing, if not near completed, at other general hospital, 3 other general hospitals. This one is located at the north, that is in Umueri, at Anambra North. Then we have our work ongoing at the same rate at Ekurabe General Hospital and also Enugu General Hospital. So we really hope that the target is to upgrade these 3 general hospitals, specialist hospital, and Enugu is already have 4 consultants working there, which obviously is going to make it a specialist hospital by the time they complete with this. So we look at it, and with numerous other general hospitals, 5 general hospitals being constructed by this administration. So we thank the governor on that, and as we said, this year is very wonderful. It looks brighter for the healthcare system. We know that the budget in the healthcare system has also improved. Some of the areas that attention has not been given, tertiary care, upgrading of the infrastructure there massively is going to happen this year.
To boost a statistically driven health sector, manual collection of data is gradually being phased out, as the Ministry of Health has also set up a situation room where they monitor outbreaks and collect valuable data on various diseases across the state. To also eliminate the proliferation of quack hospitals, the administration of Governor Charles Soludo identified quite a number of quacks in private hospitals and were closed down through the monitoring department in the Ministry of Health. Other interventions of the Soludo administration include the reinvigoration of the state emergency medical services and ambulance systems, which are now in place, ensuring rapid responses in cases of medical emergencies. Consequently, the state now enjoys emergency calls with the 112 short code, which has been super functional in Anambra State and has so far recorded 23 calls and 15 responses to emergencies after it was recently introduced. Apart from the commencement of free rotavirus vaccine in the state, with 56% reduction in diarrhea disease, there has been the implementation of mass drugs administration, MDA, in villages, churches, schools, markets, amongst others, where people can easily have access to intervention.
Our strategy is to eliminate childhood mortality and to ensure that every single child in Anambra State lives a healthy and happy life. Rotavirus can cause severe diarrhea in children. Worldwide, it accounts for approximately 1/3 of the nearly 600,000 deaths caused by diarrhea in children. Therefore, vaccination is the best way to protect our children from it. It is on this note that I encourage all mothers with children with the age of 6 to 23 months to visit our nearest primary health care center, general hospitals, private or mission health facilities offering immunization service to receive the vaccination. Remember that it is free of charge.
It is also instructive to note that at the beginning of the administration, 3.8 million insecticide-treated nets ITN were distributed across the state in conjunction with the Federal Ministry of Health and Malaria Consortium. The effect is that today, the percentage of usage of ITN has moved from 27% to 57%. Anambra Eye Care Center, located at Nise, a first of its kind in the state, has equally been set up and is running at jet speed. Since it came on board, and with the employment of ophthalmologists, over 400 patients have been attended to, out of which 104 cataract surgeries have been perfected. 17 pterygium surgery have also been executed at very reduced costs to the patients.
Because of the success we have recorded, we are seeing a lot of patients. Today we saw about 25 to 30 patients, and I did one surgery today, one cataract surgery today. And it's because of the success that we are having. That's why people are coming. And so I want to especially thank the governor and then the Ministry of Health for establishing the place. Before now, people had to go to Enugu, Oji River. That's the closest place they can get these eye surgeries done. Or down to Onitsha, Guinness Eye Center. But now, because it's the indigenous, the people in Nise, Nibo, Enugu, and the surrounding villages, they come here for eye care.
A milestone of the Soludo-led administration in the health sector is the establishment of market clinics. Today, there are clinics in markets across the state to end the era of having market people collapse due to not checking themselves to ascertain their health status. The Onitsha main market is a case in point, as traders can now easily have access to healthcare services while carrying on with their daily businesses in the market. All these have been made possible courtesy of Governor Soludo's administration.
The hospital is very fine, very good. They have equipment. We have there like last two days. We do the cleanup here. So there's one of my brother who injured. So we go to the hospital, they treat us well. They did well. I can see they work well. We are thanking the excellency. He did well by putting the clinic in the market. We all traders market, we appreciate him. We thank him.
I'm urging my fellow market traders, they should come and be going there, because the government's own is not this one they give anyhow, because I know that government drugs work very well. It's well treated than others. They produce anyhow. But I know that government's own is more effective to others. I'm thanking Governor Soludo because he's doing a wonderful work.
We just pleaded to the governor. He came to our rescue by raising the health center for Onitsha main market. We give special thanks to the Commissioner for Health that he's the one that we cry to, and he take our request to our dynamic governor, which they confirmed it from me, which I confirmed it to the governor that this is one of the things that main market highly need, especially this time he's changing all aspects of Anambra State to be Taiwan in Nigeria. So he touches all the angles of main market. About 4 major roads that leads to main market. The governor came down and awarded to this area. All those things is things that we are introducing to. We are informing makers so that's why the traders take our governor to the highest aim. One of the best governors we ever have in the state.
Within 6 weeks of Governor Soludo's historic visit to Olumbanasa, being the first governor of Anambra State to physically visit the forgotten island community by boat, keke and Okada ride in Anambra West, in fulfillment of his promise to the people in those communities, the health facility in that location has been rebuilt with relevant equipment and staff.
The very first one that was built, that was destroyed in 2012, was not anything to call a health center. But this is the very first time we are seeing a modern health center. So, and this thing will help us in a great way, because a lot of lives have been lost here over the years. People fall ill in the night, before they cross them over, before you know it, they are dead. And this is now a savior. We cannot thank Professor Charles Soludo. We cannot thank him enough. We cannot. We have never seen this type of a thing.
Also, in a significant move towards self-sufficiency, Governor Soludo's administration has initiated the establishment of a medical oxygen production plant and an endoscopy unit at the General Hospital in Onitsha. The deployment of hematology analyzers to the laboratory departments of general hospitals in Agolo and Nobi demonstrates Governor Soludo's dedication to advanced and accurate medical diagnosis for the people. Apart from the activation and equipping of dental units in general hospitals in Enugu, Umueri, and Ekulobia, there has been the building of a massive story building for demonstration room, classroom, and administrative blocks at the School of Health Technology, Obusi. By putting in place these infrastructure, accreditation has been given to 7 departments in the school. There has also been the provision and activation of mammography unit, activation of the refurbished dialysis center. These are all efforts of Governor Soludo geared towards providing adequate health care to Ndi Anambra. Anambra State Health Insurance Agency, ASHIA, also keyed into the solution manifesto of Governor Soludo to expand the insurance package and translate it into the next level in insurance. Under the government of Governor Soludo, the insurance package was expanded without an upward review of the annual 12,000 naira. MRI, CT scan, transvaginal USS, histology, prostatectomy with the usage of technology to avoid queries, amongst others, were introduced. The impact of this strategic intervention by the government is that the number of enrollment has increased from 183,000 in March 2022 to 222,426 till date.
I registered into Anambra State Health Insurance Agency in 2019. I am assessing care from Nume Hospital OBD. I benefited by not paying the necessary hospital bills that I was supposed to pay. I paid just the paltry sum of 30,000 naira, whereas I had my babies through elective CS. I was treated like a queen, and my babies, you can see them, they are beautiful.
The old saying, "You are what you eat," has never been more relevant than it is today. In the state, an aspect of health that has generated positive outcomes is the Healthy Living with Nonye, an initiative and a pet project of the governor's wife, Mrs. Nonye Soludo. In addition to all these initiatives, the Healthy Living with Nonye Soludo encourages healthier eating and better nutrition with several programs designed to promote healthy living across all age brackets in the state. As a result, monthly exercise was introduced by the governor for government officials and interested Ndi Anambra at the Awka City Stadium to drive home the mantra of his wife: exercise dirty, eat clean.
Wow! Lots of life-changing and life-saving interventions by Professor Charles Soludo in the Anambra State Health Sector. Well, this is just part 1. On our next edition, we'll bring you the concluding part of Professor Charles Soludo intervention in the Anambra State Health Sector. Please follow us across our social media platforms on Facebook, YouTube, TikTok, and Instagram. It is at Solution Footprints, and on X, formerly Twitter, it is at Solution FP. Join the movement towards a livable, prosperous, and healthier Anambra. I am Ife Aronwokafo. See you next.
To make Anambra shine with our sweat and blood, every breath of our lives, we've trust in God.